Welcome back. Prostate cancer is the uncontrolled growth of cells in the prostate, a gland in the male reproductive system below the bladder. Abnormal growth of the prostate tissue is usually detected through screening tests, typically blood tests that check for prostate-specific antigen level. Now, this morning, we are joined by Dr. Kagiso Moloi to talk to us about his medical journey with prostate cancer. Good morning and welcome to GMN.
Good morning, good morning, Namibia, and thank you for having me.
Thank you so much for joining us.
Before I start talking, I just want to talk about Movember.
Yes, of course.
This is a month where we try to conscientize, especially men, to really go out there, go do their test with their GPs in order to ascertain whether there's anything underlying. Things like high blood pressure, high glucose levels is something you don't feel. You don't feel pain, you don't feel it in your body. So it's something that needs to be tested. So usually the GP would take a vial or two of blood, send it to the pathology lab, where they would be able to ascertain whether there's any problems within your system. And then another disclaimer, I'm here talking about my story. I'm not soliciting any sympathy or empathy from anybody. All I need to do is just to make the Mo bros, the brothers, to go to their doctors and to their annual medical checkup.
And we applaud you for that, for your bravery.
Thank you very much.
You've actually just touched into something that I wanted to speak to later in our conversation, but we can really just go there. To say Movember, right, is all about men's health and everything, but really just bringing attention to say beyond November, men must get regular checkups.
There's this notion that men must not cry. They say tigers don't cry. Men should cry. If we've got men crying out there, we wouldn't have so many suicides in our society, because they would cry and somebody will listen to their cry. So we are encouraging men to really come out and men talk about anything else. They talk about soccer, Manchester United, Arsenal. They talk about women's omatakos. They talk about beer. They talk about any except their health.
And we need to get comfortable with those uncomfortable conversations.
Yes. Usually, women, it's very easy. They just go for coffee and say, I felt the lump. They tell the friend, I felt a lump. I don't know what to do. The other one said, no, I had the same thing. I went to Dr. So-and-so and I got help. But with men, they just keep quiet and they die inside.
And sometimes, doctor, something that actually just came to mind now, sometimes society doesn't help at all. There was an image that was going around recently on social media about prostate cancer and how the test is done.
Yeah.
It ended up becoming a mockery.
Yeah, it becomes a mockery because usually men would say, what? Where does the finger go of the urologist? No, I'm not going to do it.
It's not me.
No, it's not me. And it's a very simple procedure. Okay, let me start from the beginning. When I graduated my matric, I went to enroll as a medical, I did a diploma in medical laboratory technology at the University of Johannesburg. That time it was called Technikon Witwatersrand. And when I finished, I worked at the lab. So all I could see is a specimen, the blood specimen. It's got a number. It's got no it's got no person's name. It's got a number on it. There's a number on there.
There's no face to it.
There's a form there. I fill in that what I observed or what the machine has given me. Whether the PSA is high, the PSA is low, the blood cells are fine. The white blood cells are not fine. The folic acid and all those minerals are fine in the body. And also I was also doing cellular pathology. Cellular pathology is where they do a biopsy and then we prepare it with wax, cut it and go to the microscope. So I had that relationship and I had no empathy or any sympathy.
There was no face to it.
There
It
was
was
no
just
there
a number.
was no face
Yes.
to it. So I decided, no, let me go study medicine. And I applied for medicine and dentistry. Unfortunately, because I wanted to do medicine, I was taken in dentistry. but I don't regret being a dental surgeon presently. So I moved to Namibia in 2002. And in 2014, I started a program called Breakfast Health with Dr. Moloi on Energy 100 FM. And then that's when I started the Movember movement.
Yes.
Every November, I would call in specialists and talk about this. But between 2016 and 2017, when I did my annual checkup, the prostate-specific antigen came back very high. And my urologist said, hey, this is a cause for concern. It's either you've got a benign prostate hyperplasia,
Yes.
and we need to check further. And checking further means,
Yes.
we call it digital. I also thought digital is something electronic. It means the finger, it goes into the exhaust, so that he can be able to see the extent of the growth of the prostate. I did that, and that's the test most men dread. They don't want to have it. They say you can't put anything in there.
Yes.
And it's very important for the urologist to do that. And then when he found that it was big, so we had to do a biopsy. The biopsy is not so comfortable, but he makes it comfortable because he applies some topical anesthetic on his finger and put it there. And it's like a puncher. It's like a gun. So it goes in there, it punches, and takes some
But that
tissue.
sounds very scary, doctor.
Yeah, no,
You
but
see,
you
and I
should,
think that is what they hear.
But
Yeah.
we need to prepare men to
Yes,
know
mentally
that this
to know what to expect.
what to expect, because usually what makes them fear is a fear of unknown.
Yes.
It's not
Yes.
it's not painful, as I said. They
I think
applied,
that is very important
they
to know.
applied a
Yes.
topical anesthetic, and then they took the samples, took them to the laboratory, and they came back and said, I'm stage 2 cancer. So stage 2, after stage 2 is stage 3 and stage 4. And
What was going through your mind when you got the diagnosis?
I cried. I cried because my children were still at school. One was 15, one was 10, one was 9. And I couldn't even tell them because I thought I'm going to disturb them with their academics. So thankful to my wife who was there by my side. Yes. Every visit we went together. And I also started the psychological therapy. I went to Dr. Sean Whitaker, who counseled me through the process. And I went into depression, by the way. I went into depression because when you hear the word cancer,
it's a death sentence.
It's a death sentence. So that's what came.
It's not supposed to be, and it is not in
It's
many
just-
cases.
it's
But
not.
that's what
That's
you
why
hear.
I'm trying to.
That's what you hear.
That's why I'm trying to relate to the brothers that it's not a death sentence, and keeping quiet and doing nothing about it, you're letting the cancer to metastasize. Metastasize, it means it spreads. It spreads to your bladder. It spreads to your rectum. It spreads to your urethra, because the purpose of the prostate is to give liquidity to your sperms. So when your sperms are produced in your testes, they come through. As they come through, the semen from the prostate gives them the mobility. So it gives them juice to be able to move. So if the prostate is affected, you'll have a problem with sex. So, or you'll have a retrograde ejaculation. Retrograde ejaculation means instead of your sperms going forward, they go backwards. So you won't produce children in that fashion.
And especially in Africa, for an African man,
Yeah.
especially to hear something like that.
To hear
is
something like that.
worrisome.
Yeah,
but
I just want to lay it bare so that we know about this, and you know it from a
get-go,
first-hand
yes.
person who had a problem, and my urologist told me that I've got a couple of options. It's either with you hormone therapy, but he told me that the hormone therapy, it won't do much because of the stage I'm at.
which was stage 2 at the time.
Stage 2.
Yes.
Immunotherapy is also trying to boost my immune system to counter the problem. It won't be effective. So we've got radiation therapy, brachytherapy, and chemotherapy. Chemotherapy is something that affects your whole body. Brachytherapy is like a staple. So one staple?
Yes.
Yeah. It's like one staple cut into 4 equal parts. So those are radiation seeds.
Okay.
These radiation seeds are put into a gun, and then you're put to sleep in the theater. Nothing is cut. They go through your exhaust, and then they go plant these radiation seeds inside your prostate. So these radiation seeds will start radiating radiation treatment and kill the cancer cells. Or another option is radical prostatectomy. Prostatectomy means it's removed completely. Usually it's removed completely if they can see that brachytherapy won't work, because it has gone to an extent of stage 4 sometimes, but it has not metastasized to surrounding areas. So what they do is that they just remove the whole prostate. And you should know that if the prostate is removed, you're going to have all other problems with your sexual life for the rest of your life. So after the radiation therapy, for me, that is brachytherapy, after 6 months, I went to do PSA, and it was dropped. It had dropped so drastically that even the urologist was so amazed that it worked so quickly on me. And since then, I've been doing, it was 6 months before. Every 6 months, I used to do the test, the PSA, and then I've moved to 1 year now. Every November, I just go for my PSA test, and it has been normal since 2016, 2017. And I'm very grateful to my wife, who's been there by my side. And the depression just went especially when I got the first results that on the first 6 months that the cancer has stopped growing, and everything is fine. And here I am.
So if I'm understanding you correctly, I'm hearing moral support, really working closely with your urologist to know and get all these options, and just really facing it. And yes, and definitely psychologist, and facing these matters head on.
Yeah, because a psychologist must be part of the deal.
For that wholesome approach.
Yeah, because mental health has become so important in this modern age. People are killing themselves, are committing suicide because of not understanding their diseases. Some of them have got HIV, and HIV is treatable now. We are even going into the age of having a vaccine against HIV.
Yes.
So I see no reason why should somebody who's diagnosed with things like prostate cancer or HIV go and hang themselves when there's a solution. So I'm encouraging the brothers, please go out there. Let's live this mature attitude that I don't cry.
Not me, I don't cry. It's never happened to me.
It won't, the problem is it won't happen to me. He's a mukhudaiman. That one who talks about it, he's just a mukhu. And now, there's no way me I can go for such tests on my
Doctor,
body.
if I can just interject a little bit. What are some of the things you wish you knew sooner or earlier about prostate cancer?
I wish I had as a medical technology laboratory technologist. I wish I knew deeper into it, because I only knew the theory part that we are looking for PSA, and we use the machines to determine that. I didn't give it a thought that this is a human.
Yes.
It's a human disease. It must be approached with a human touch. So I was at a distance, but when it occurred to me, it came closer to me, and I think everybody, even boys at the high school, during their life science or one of those
Yes.
subjects, there must be taught of such diseases.
What would you say are some of the best ways of taking yourself when you're given that diagnosis that you've got prostate cancer from your experience?
Yeah, it's just sit back and reflect on yourself. Firstly, your lifestyle. Secondly, how deep the problem is. Seeking attention, seeking medical attention. Yeah, that's one of the first things. Going to the right doctor who will refer. Usually, a GP must refer you to a urologist, and then making sure that your mental health is attended to at the same time.
Now, any final remarks from your end, especially given we are in the Men's Health Month, if I can call it that, November?
Yeah. To the Mo Bros, please go for your checkup. It takes nothing. It's just a vial of blood that is taken, and from there you'll get an overall picture on your health. And please attend to whatever is discovered, attend to it early, because usually when we leave things till late, they cannot be salvaged.
Thank you so much, Dr. Moloi, especially for your bravery. We just really applaud you for spreading the message, telling your story so that other people can learn from your experiences as well. Thank you.
Thank you for having me, and thank you, Namibia. Please, gents, let's go and do our medical checkups.